Recipients of New England Donor Services in Waltham came to Newton City Hall to share stories of survival from organs donated to them or their family members. They are also encouraging residents to become organ donors because of how many people can be helped from one person. Here's more from that event.
We have to keep remembering that these miracles can happen every day, and they do happen every day, but only if people step up, and particularly when they're renewing their driver's license, step forward and make sure that they are on the organ donation list.
You can register at any age, and you go to registerme.org to do that. We actually do have work with driver education schools, because the vast majority of individuals who do register here at the state of Massachusetts at the RMV. In fact, 99.6% of all people in Massachusetts who register do so at that important state agency, and that's actually true throughout the country. I do want to say that organ donation is extremely rare. You're actually more likely to need a transplant than to become an organ donor. And in fact, only 2% of all deaths happen in a manner that one can become an organ donor. Today in the United States, there's over 115,000 people waiting for the life-saving transplant, and sadly, 21 people will die each day waiting for that transplant. Our objective is to try to help save as many lives as possible. Pinnacle importance is life. Our motto is donate life. We don't want anyone to pass away, period. Police, fire, EMT do a wonderful job of one thing, and that's saving people's lives and getting them from an event to the hospital as quickly as possible. They have no say in the organ donation process. The doctors and nurses at the hospital do a wonderful job of saving people's lives. They have no say in the organ donation process. That only occurs when the OPO, Organ Procurement Organization, is called to see if that individual could be a good candidate for an organ donor. And that only occurs, sadly, when someone has passed away.
My name is Jim Pazanese, and I'm here today because somebody donated a lung. I had a lung transplant 5 years ago. I have pulmonary fibrosis, which most people have never heard of. But I'm standing here today because of that, and I'm healthy, and I have one lung. So, and I also volunteer for the Brigham and Women's Hospital, a wonderful organization, and I volunteer for the New England Donor Services for 4 years now. It's just a wonderful organization. I do that because I want to give back. I was given a gift, saved my life, and I need to give back. So the organ donation system, and I also go to Watertown RMV and spend some time there with the folks and encourage people to check the box and donate a life. My theme is what I tell them. I said, be a hero. The last thing you do on this earth is be a hero for somebody. And that's what I do, just give back.
We're also here to thank the Massachusetts Department of Health. They have a campaign to encourage people to register at any age. People can register in their 50s, 60s, 70s, 80s, and even 90s. We don't want people to self-select themselves out. There are people on the waiting list that are so sick that even not a perfect organ is going to be better than the organ that you have. Additionally, people can receive transplants at any age. We were just talking about Dick Cheney, the former Vice President of the United States, received a heart transplant at age 72. Do not rule yourself out. And again, thanks to the Massachusetts Department of Public Health. On the website, registerme.org/MA, there's 2 fantastic videos that are actually being played on the radio today, actually all this month and next month, indicating that you can register at any age. And we want to educate to the population that may be called a little bit older. I will define that, whatever that is. I will say up to 150. We want to encourage those individuals to register.
I'm speaking on behalf of my husband, Art, who was a heart recipient. And he had a beautiful heart and lived a full and lovely, beautiful life for 9 years. And he was able to see, both our daughters were married, but he was able to see after the transplant his second daughter married and 4 grandchildren. And he was so actively involved along with Matt Boger and helping with getting legislation through to make people more aware of what is going on and how wonderful being a donor can be. And working with the transplant area. Art received his heart transplant from Tufts Medical Center, and they saved his life. And we had many years of wonderful time together. And the story that I have to tell for Art is that it was very important to him that he be able to give as well as to receive. So at the end of his life, he was able to donate both corneas, and 2 people can now see because of Arthur. And it's a wonderful, beautiful story, and I want to thank you for letting me share today.
My name is Dick Bale. I've lived here in Newton for about 45 years. I'm a retired physician in primary care and public health, so I'm well aware of the global importance of this issue internationally. My story was that I was serving in Africa in the World Health Organization and somehow acquired hepatitis C, I think through the practices of a local dentist there. I was compelled because of a dental emergency to seek care. And for 20 years, I had the hepatitis C, and I was screened to make sure that I wasn't going to develop a cancer. I did develop the cancer in between those screenings, and by the time it was discovered, it was nearly inoperable, 1 millimeter, and I wouldn't have been qualified for a liver transplant. So then I had to go desperately searching all over the country, literally, for a center that did liver transplants and had a short enough waiting list so that I wouldn't be disqualified. I found that, fortunately, and there's not a minute that goes by in my life that I'm not grateful for that. It's just incredible that science and the people in these organizations, the doctors and people in Donate Life, can bring us together to a state that many, many people's lives are saved each year. I also wanted to just give one brief statistic. A healthy donor can save 8 persons' lives through organ donation. As Wendy just mentioned, you can restore vision to 2 people with your corneas, and through the donation of tissues such as bone marrow and cartilage, you can help 75 people heal. So the donation of your body after an unexpected death is a gift that will benefit many, many people. I want to especially thank Mayor Fuller and the health department here for their leadership in bringing to light this very important public health problem and bringing Newton, the awareness to Newton and surrounding communities of the importance of registering to donate.
Hello, everybody. My name is Jim O'Hare, and real happy to be here today. Fortunate to be here. I've been living in Newton for about 10 years. My life partner is here, and she was a teacher at Newton North for over 30 years. So when I retired and moved here in '08, I started to bike the whole city and walk the whole city and went on the conservatives' walks, and I was having a heck of a time. And all of a sudden, I couldn't do it. All of a sudden, I couldn't breathe like I used to, like I've done all my life. And this disease came out of nowhere. There was no explanation for it. I went to Beth Israel and spent 2 or 3 years there trying to explore it, get to the bottom of it, try to deal with it through medication. And in the fall of the year 2013, my pulmonologist at BI said, "I'm out of tricks." What does that mean? He said, "The only solution for you is a transplant." And, it was impossible really at that time for me to process what that could mean for me and how I would go about it. But I went to the Cleveland Clinic, and in August of 2014, I received the lung like Jim Pazanisi, and here I stand before you today, doing virtually everything I was doing before. I'm not biking, I'm not jogging, but I'm pursuing all of the other interests in my life that are important to me and that keep me happy and make me who I am today, make me the person that I want to be, including with my sons and my grandchildren and my daughters-in-law, and I have a full life, and I'm just absolutely grateful for it, and to the lung donor and to this organization that I'm now part of, New England Donor Services, and their efforts, and to see them in operation, to see the enthusiasm of the volunteers and the people that work there is just very gratifying. And to have a chance like this today is also. So thank you for listening.